South Africa could be facing a crisis if medical practitioners continue leaving the profession as the result of an increase in medical malpractice claims and expensive risk insurance. We're now joined by Volker van Widden, CEO of Constantia Insurance Group, which has developed South Africa's first homegrown product for local doctors. Thanks very much for coming in to speak to us, Volker. I must ask you to start off with just how high is the number of successful medical malpractice claims against South African doctors?
It's relatively low.
But many of them have to buy into this product, and I understand on an international basis.
The current major provider is an international supplier. It has been for a while, and we think that's unnecessary. It's quite competent for South African parties to provide this cover to our colleagues. And as regards have to, practitioners have the option of buying medical indemnity cover, and most of them do, particularly in private practice.
So just describe to us the local product you've developed and how that differs from the international product being offered up to now.
The local product is far more competitively priced. It's on exactly the same occurrence wording, and that's important because if an event happens this year but you're only notified about it in 3 or 5 or 7 years' time, you still have the cover because you don't quite know how medical issues may transpire. It's far more transparent. It accesses and it uses the local associations well. It interacts and really fosters and invests in risk management right through the healthcare delivery cycle. So it's entirely opposite to the model where one pays a premium and prays that nothing happens for 5 years and then a bomb goes off later on, then one scrabbles around trying to get the evidence. We walk the road with the doctors and the practitioners throughout the process so that we can actually introduce a peace of mind, a state of calm and normality into what they're doing. We're also going to be quite careful about the increase in litigation because we don't think this actually reflects the underlying risk. And we've actually priced this for normal risk behavior, and we believe we can give the doctors a far better deal.
So when you talk about a better deal, what's the highest premium the average South African doctor would be paying?
Going into next year, we understand that the premiums will range between 850 and R1 million a year for the highest risk sectors. Our highest premium for a normal risk will be 526,000.
So when you talk about the highest risk sectors, what would those be? Are those specialist
The obstetrics and gynecologists, yeah.
And I mean, just give me a sense of this because many of our viewers would be wondering exactly whether they're being protected against doctors who are unscrupulous in the way they carry out their work. Is that a worry for the patient?
It is a fair worry, and we don't say that doctors make no mistakes. In fact, what we want to do is we want the health outcome to be the first priority. So if someone's been hurt, we want the money to go directly towards health outcomes. At the moment, it seems to be going to litigation and many other places, big arguments and big perceptions of risk issues, rather than addressing the health outcome and moving on. We also want to change the entire engagement model and show that we have credible expert people involved and that we want to use forms of arbitration and mediation that allow people to just say, okay, there may have been something that we didn't understand together. Let's get on with the job of helping the patient and let the doctor get on with providing health services to their community and their environment. Whereas at the moment, it's very adversarial, highly costly, and it doesn't add value to the community.
Are you not afraid of the kind of risk to you, given the fact that more South Africans are far more aware of their rights right now, and the public in many areas is simply just becoming more litigious?
They are more litigious, and they have those rights, and we absolutely respect them. The point that we would like to say is, aren't we concerned about the patient? Aren't we concerned about the financial outcome that provides you a rock-solid guarantee of claims in South Africa that's not under any external jurisdiction, and then addresses the needs of healthcare and those things going forward? So much of the debate is about how much the quantum is rather than looking after the patient that needs the care. And we think that by addressing patient needs directly and showing that we are honest and direct about that, that we will address the real need, which isn't litigation, it's about the patient.
Thank you very much for talking to us. Good to speak to you, Volker van Widden, CEO of the Constantia Insurance Group.